Good evening, one and all. We welcome you all to the international webinar series on holistic health, sustainable development, and well-being. Good evening, one and all. We welcome you all to the international webinar series on holistic health, well-being, and sustainable development 2022, commemorating Azadi Ka Amrit Mahotsav celebrations. Nation celebrating 75 years of independence and United Nations Sustainable Development Goals SDGs 2015 to 2030 as part of awareness and campaigns in collaboration with Sri Holistic Health Foundation India, Sri Research Institute Center for Art Sciences and Wellbeing. Before we start our sessions, let's take the blessings of Almighty.
शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः शुभं कुरुत्वं कल्याणम् आरोग्यं धनसम्पदः.
With the blessings of Almighty, we shall continue to today's session. Today, in the context of pandemic, today we are commemorating International Day of Epidemic Preparedness. COVID-19 is a human tragedy, but it has also created a general opportunity, an opportunity to build back a more equal and sustainable world. The response to pandemic and to the widespread discontent and preceded it must be based on a new social contract and a new global deal that create equal opportunities for all and respect the rights and freedoms of all, as quoted by Antonio Guterres, Secretary General of United States. So, as exemplified by the ongoing coronavirus disease, COVID-19, pandemic major infections and epidemics have been devastating impacts on human lives, wreaking havoc on long-term social and economic development. Global health crisis threaten to overwhelm already overstretched health systems, disrupt global supply chains, and cause disproportionate devastation of the livelihoods of people, including women and children, and the economies of the poorest and most vulnerable countries. There is an urgent need to have resilient and robust health systems, reaching those who are vulnerable or in vulnerable situations. In the event of absence of international attention, Future epidemics could surpass previous outbreaks in terms of intensity and gravity. There is a great need of raising awareness, the exchange of information, scientific knowledge, and best practices, quality education, and advocacy programs on epidemics at the local, national, regional, and global levels as effective measures to prevent and respond to epidemics. It is important to strengthen epidemic prevention by applying lessons learned on epidemic management and how to prevent the stoppage of basic services and to raise the level of preparedness in order to have the earliest and most adequate response to any epidemic that may arise, and recognizing also the value of integrated One Health approach that fosters integration of human health, animal health, and plant health, as well as environmental and other relevant sectors. So international cooperation and multilateralism play an important role in the response to epidemics. We need to stress the significance of partnership and solidarity among individual, community, and state and regional and international organizations in all stages of epidemic management, as well as the importance of considering a gender perspective in this regard. The United Nations system, in particular, the World Health Organization, plays a pivotal role in coordinating responses to epidemics in accordance with its mandate and in supporting national, regional, and international efforts to prevent, mitigate, and address the impacts of infectious diseases and epidemics in accordance with the goal of advancing the 2030 agenda. We need to recognize the primary role and responsibility of governments and indispensable contribution of relevant stakeholders in tackling global health challenges, especially women who make up the majority of the world's health workers. UN member states commit to ensure inclusive, equal, and non-discriminatory participation with special attention to those who are vulnerable or invulnerable situations with the highest chance of epidemic infection. The UN General Assembly invites all member states, organizations of the United Nations system, and other global, regional, and sub-regional organizations, the private sector, and the civil society, including non-governmental organizations, academic institutions, individuals, and other relevant stakeholders to observe the International Day of Epidemic Preparedness annually in an appropriate manner in accordance with the national context and priorities through education and awareness, raising activities in order to highlight the importance of prevention, of preparedness for and partnership against epidemics. So we have similar observances, commemorations, which are related to health, like World Health Day on 7th April, World Water Day on 22nd March, World Autism Awareness Day, 2nd April, World No Tobacco Day, 31st May, International Day Against Drug Abuse and Illicit Trafficking on 26th June, World Mental Health Day, 10th October, World Suicide Prevention Day, 10th September, World Diabetes Day, 14th November, World AIDS Day, 1st December, International Universal Health Coverage Day, 12th December, and many more. The COVID-19 pandemic is more than a health crisis. It is an economic crisis, a humanitarian crisis, a security crisis, and a human rights crisis. This crisis has highlighted several fragilities and inequalities within and among nations. Coming out of the crisis will require a whole of society, whole of government, and whole of the world approach driven by compassion and solidarity. The UN Secretary General has launched the UN Comprehensive Response to COVID-19 to save lives, protect societies, recover better. So the World Health Organization has an essential role to play in supporting member states to prepare for, respond to, and recover from emergencies with public health consequences. Let's watch a short video.
To believe that only a year ago, COVID-19 was still completely unknown to us. In the past 12 months, our world has been turned upside down. The impacts of the pandemic go far beyond the disease itself, with far-reaching consequences for societies and economies. But none of this should come as a surprise. Over the years, there have been many reports, reviews, and recommendations all saying the same thing. The world is not prepared for a pandemic. We must all learn the lessons the pandemic is teaching us. First, all countries must invest in preparedness capacities to prevent, detect, and mitigate emergencies of all kinds, whether they be natural occurring epidemics or deliberate events. Strong primary health care is especially important at the foundation of universal health coverage and at the eyes and ears of every health system. Second, true preparedness is not just a job of the health sector. It requires an all of government and all of society approach. And third, the pandemic has highlighted the intimate links between the health of humans, animals, and planet, which we can only address with a One Health approach. Any efforts to improve human health are doomed unless they address the critical interface between humans and animals and the existential threat of climate change that's making our Earth less habitable. History tells us that this will not be the last pandemic, and epidemics are a fact of life. But with investments in public health, supported by an all of government, all of society, One Health approach, we can ensure that our children and their children inherit a safer, more resilient, and more sustainable world. I thank you.
If we fail to prepare, we're preparing to fail. Both the coronavirus and Ebola outbreaks underscore once again the vital importance for all countries to invest in preparedness, not panic. So far, more than $1 billion has been spent trying to stop Ebola outbreak in DRC. By comparison, just $18 million was spent on preparedness in Uganda. But when Ebola did cross the border to Uganda, they were ready and stopped it. This must be a lesson for the rest of the world. Last year, the Global Preparedness Monitoring Board published its first report, which concluded the world remains dangerously unprepared for a global pandemic. For too long, the world has operated on a cycle of panic and neglect. We throw money at an outbreak, and when it's over, we forget about it and do nothing to prevent the next one. This is dangerously short-sighted and frankly difficult to understand. The only way we will defeat this outbreak is for all countries to work together in a spirit of solidarity. We're all in this together.
The World Health Organization is working closely with global experts, governments, and partners to rapidly expand scientific knowledge on this new virus to track the spread and virulence of the virus and to provide advice to countries, individuals on measures to protect health and prevent spread of this outbreak. As we all know, COVID is still not yet gone and is an infectious disease caused by SARS-CoV-2 virus. Most people infected with the virus will experience mild to moderate respiratory illness and recover without getting special treatment. However, some will become seriously ill and require medical attention. Older people and those with underlying medical conditions like cardiovascular disease, diabetes, chronic respiratory disease, or cancer are more likely to develop serious illness. Anyone can get sick with COVID-19 and become seriously ill or die at any age. The best way to prevent and slow down transmission is to be well informed about the disease and how the virus spreads. Protect yourself and others from infection by staying at least 1 meter apart from others, wearing a properly fitted mask, and washing your hands or using an alcohol-based rub frequently. Get vaccinated when it's your turn and follow the local guidance. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. It is important to practice respiratory etiquette, for example, by coughing into a flexed elbow, and to stay home and self-isolate until you recover if you feel unwell. So stay informed about various practices, and to prevent infection and to slow transmission of COVID-19, do the following. Get vaccinated when a vaccine is available to you, including all the booster doses as and when required and suggested. Stay at least 1 meter apart from others, even if they don't appear to be sick. Wear a properly fitted mask when physical distancing is not possible or when in poorly ventilated settings. Choose open, well-ventilated spaces over closed ones. Open a window if indoors. Wash your hands regularly with soap and water or clean them with alcohol-based hand rub. Cover your mouth and nose when coughing or sneezing. If you feel unwell, stay home and self-isolate until you recover. As COVID has developed many noticed and unnoticed symptoms, but in general, COVID-19 affects different people in different ways. So most infected people will develop mild to moderate illness and recover without hospitalization. The most common symptoms include fever, cough, tiredness, loss of taste or smell, and less common symptoms include sore throat, headache, aches and pains, diarrhea, a rash or skin or discoloration of fingers or toes, red or irritated eyes, and serious symptoms include difficulty breathing or shortness of breath, loss of speech or mobility or confusion, chest pain. Seek immediate medical attention if you have serious symptoms. Always call before visiting your doctor or health facility. People with mild symptoms who are otherwise healthy should manage their symptoms at home. On average, it takes 5 to 6 days when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. Even if you are vaccinated and even if you have got booster doses, always follow the guidelines. Vaccine is not a cure. for COVID-19, and vaccine does not 100% prevent COVID-19. So it is an additional protection, and it decreases the risk or the vulnerability towards the COVID. But we have seen, even if people after getting vaccinated and even after getting booster doses, they are getting COVID-19. This is because of their occupational hazard, working in clinical settings due to exposure, or due to occupational settings, work at workplace, or at times due to negligence, that we have taken vaccine and we will not acquire any more infection. So in any case, in certain cases where it is unavoidable, where especially the frontline workers, health workers, and medical professionals, medical health professionals, and paramedical professionals, and other sanitary workers, and other staff, and even police and other security personnel and logistics. And there are various other industries like labor intensive industries where we all need to work in unwarranted situations. At the same time, we also need to take care of ourselves and follow the guidelines. Still, we can see that though we are returning to normal, but still we are seeing the rise in cases across the world, and even in China also there are reports of lockdown and huge number of deaths that are happening. Anyways, still by God's grace, the situation is under control, but we should not take it for granted, and we should always follow guidelines from time to time as prescribed by the Ministry of Health and health professionals. So stay safe, protect yourself. The COVID-19 pandemic has underscored the importance of investing in systems to prevent, detect, and respond to the infectious disease outbreaks. The first ever International Day of Epidemic Preparedness, being held on 27 December 2020, was called by the United Nations General Assembly to advocate the importance of prevention, of preparedness for, and partnership against epidemics. The World Health Organization works closely with governments to support efforts to build strong emergency and epidemic preparedness systems as part of an overall approach to advance universal health coverage and strengthen primary health care systems. If we do not pay attention at an international level, future pandemics could be more intense and serious than previous outbreaks. Raising public awareness, exchanging information, scientific knowledge, and best practices, providing quality education, and instituting epidemic awareness programs at the local, national, regional, and global levels are essential, as they are effective measures to prevent pandemics and respond to them. The risks of getting COVID-19 are higher in crowded and inadequately ventilated spaces, where infected people spend long periods of time together in close proximity. Outbreaks have been reported in places where people have gathered, often in crowded. Often in crowded indoor settings and where they talk loudly, shout, breathe heavily, or sing, such as restaurants, choir practices, fitness classes, nightclubs, offices, and places of worship. To make your environment as safe as possible, avoid 3Cs spaces that are closed, crowded, or involve close contact. Meet people outside. Outdoor gatherings are safer than indoor ones, particularly if indoor spaces are small and without an outdoor air coming in. If you can't avoid crowded or indoor settings, take these precautions. Open a window to increase the amount of natural ventilation. When indoors, wear a mask and keep good hygiene. By following good respiratory hygiene, you protect the people around you from viruses that cause cold, flu, and COVID 19. To ensure good hygiene, you should regularly and thoroughly clean your hands with either an alcohol based hand rub or soap and water. This eliminates germs that may be on your hands, including viruses. Cover your mouth and nose with your bent elbow or a tissue when you cough or sneeze. Dispose of the used tissue immediately into a closed bin and wash your hands. Clean and disinfect surfaces frequently, especially those which are regularly touched, such as door handles, faucets, and phone screens. So, what to do if you feel unwell? If you have a fever, cough, and difficulty breathing, seek medical attention immediately. Call by telephone first and follow the directions of your local health authority. Know the full range of symptoms of COVID 19. The most common symptoms of COVID 19 are fever, dry cough, tiredness, and loss of taste or smell. Less common symptoms include aches and pains, headache, sore throat, red or irritated eyes, diarrhea, a skin rash, or discoloration of fingers or toes. Stay home and self isolate for 10 days from symptom onset, plus 3 days after symptoms cease. Call your health provider or hotline for advice. Have someone bring your supplies. If you need to leave your house uh, or have someone near you, wear a properly fitted mask to avoid infecting others. Keep up to date on the latest information from trusted sources such as World Health Organization or your local and national health authorities. Local and national health authorities and public health units are best placed to advise on what people in your area should be doing to protect yourself. Though today, International Day of Epidemic Preparedness serves the purpose of creating awareness about epidemics, the truth is the world has been infected with numerous epidemics in the history. However, mankind still managed to survive by finding ways to curb the spread of viruses. But don't you think a great number of lives can be saved if nations are already prepared for a deadly epidemic, pandemic to strike? If you believe awareness and preparedness are key, celebrate this day with great fervor and spread the message. Play your part in fighting any epidemic that might come our way. In the late 2019, the coronavirus outbreak began in China. Numerous areas of the city were sealed as the infection rate began to rise and the body count increased. However, even though news of virus spread across the world, the authorities were unable to contain the disease. Within a few months, cases of COVID-19 emerged across the world and the death toll escalated. The virus, which was initially presumed to be flu, was announced to be a pandemic that had impacted millions of lives across the world. Due to the pandemic, the holes in the healthcare systems, the gaps of several countries were revealed as hospitals ran out of beds and ventilators. In fact, there was a point when hand sanitizers and surgical masks were also out of stock. However, after months of studying the pandemic, several health experts believed that the COVID-19 could be contained if the world was prepared. Keeping this in mind, the first ever International Day of Epidemic Preparedness was held on December 27, 2020. This day was called for by the United Nations General Assembly to advocate the importance of the preparedness for and partnership against epidemics. This was deemed necessary since COVID-19 highlighted the importance of investing in systems to prevent, detect, and respond to infectious disease outbreaks. COVID-19 is a human tragedy, but it has created a general opportunity, an opportunity to build back a more equal and sustainable world. So December 31st, 2019, cases of clusters of pneumonia are reported in China, the mystery, and January 12, 2020, the genetic sequence of COVID-19 is shared by China, along with a lot of conspiracy theories. And January 13, 2020, the first case of COVID-19 outside China is reported in Thailand. And on March 11, 2020, WHO declares COVID-19 is a pandemic due to its alarming levels of spread and severity. It was a namesake, as already it has spread across the world. And SARS-CoV-2, it is also known as COVID-19, was first discovered in Wuhan, China, and thus originated in China. There is no currently evidence of COVID-19 being transmitted through food, but still contradictory studies do exist. If the food is contaminated with virus or the droplets of sneeze and cough, there is also risk of catching the COVID-19 virus from the feces of an infected person, but quite low. So diseases can spread faster than ever before due to globalization. It is important to share information regarding vaccines and other safety measures. And do your research, go online to find out what may cause an epidemic and how people can make an effort to control them. Hosting a webinar, seminar, conference, and sharing the knowledge you have gained is also one such initiative, like we are doing. Speak to your young ones, teach them about the importance of washing hands, staying clean, sanitizing, and other small measures that aid in limiting the spread of diseases. The 1918 epidemic, influenza killed 5% of the world population. A village area in China that is known as Hamin Manga was wiped out because of an epidemic. And the disease started in 430 BC and lasted for 5 years. There are Eurasian diseases brought to the Americas by European explorers, the American plagues, and the epidemic traveled from Asia to Europe, the Black Death. So this day is important because it spreads knowledge and awareness about different pandemics that have previously affected the world and what their causes are is crucial to prevent or combating them in future. Discussions takes place all over the world, and countries begin to formulate strategies, policies that help improve their healthcare systems. And it unites countries in combating epidemics. It's unifying. The day serves as a platform where countries from different continents join forces to take strict measures against future epidemic prepared future epidemics. So we have related commemorations as Global Hand Washing Day on October 15th and Community Health Improvement Week, January 4th to 10th, and many. Let's see some mythbusters and bust some myths. So hand sanitizers can be used often. An alcohol sanitizer does not create antibiotic resistance. Unlike other antiseptics and antibiotics, pathogens, harmful germs do not seem to develop resistance to the alcohol-based sanitizers. Alcohol-based sanitizers are safe for everyone to use. Alcohols in the sanitizers have not been shown to create any relevant health issues. Little alcohol is absorbed into the skin, and most products contain an emollient to reduce skin dryness, allergic contact dermatitis, and bleaching of the hand hair due to alcohol are very rare adverse effects. Accidental swallowing and intoxication have been described in rare cases. Alcohol-based sanitizers can be used in religions where alcohol is prohibited. Any manufactured substance developed to alleviate illness or contribute to better health is permitted by the Quran, including alcohol use as a medical agent, and even in other religions. The amount of alcohol-based sanitizer you use matters. Apply a palmful of alcohol-based sanitizer to cover all surfaces of your hands. Rub your hands together using the right technique until they are dry. The entire procedure should last 20 to 30 seconds. And touching a communal bottle of alcohol-based sanitizer will not infect you. Once you have sanitized your hands, you have disinfected them from any germs that may have been on the bottle. And if everyone uses sanitizer in a public place, such as supermarket entrance, the risk of germs on communal items will be lower and will help keep everyone safe. Vitamin and mineral supplements cannot cure COVID-19. Micronutrients such as vitamin D and C and zinc are critical for a well-functioning immune system and play a vital role in promoting health and nutrition well-being. There is currently no guidance on the use of micronutrient supplements as a treatment of COVID-19. WHO is coordinating efforts to develop evaluate medicines to treat COVID-19. Water or swimming does not transmit the COVID-19 virus. The COVID-19 virus does not transmit through water while swimming. However, the virus spreads between people when someone has close contact with an infected person. So avoid crowds and maintain at least 1 meter distance from others, even when you are swimming or at swimming areas. Wear a mask when you are not in water and you can't stay distant. Clean your hands frequently. Cover a cough or sneeze with a tissue or bent elbow. and stay home if you are unwell. The likelihood of shoes spreading COVID-19 is very low. The likelihood of COVID-19 spread on the shoes and infecting individuals is very low. As a precautionary measures, particularly in homes where infants and small children crawl or play on the floors, consider leaving your shoes at the entrance of your home. This will prevent contact with dirt or any waste that could be carried on the soles of shoes. The prolonged use of medical masks, when properly worn, does not cause CO2 intoxication nor oxygen deficiency. The prolonged use of medical masks can be uncomfortable. However, it does not lead to CO2 intoxication nor oxygen deficiency. While wearing a medical mask, make sure it fits properly and that it is tight enough to allow you to breathe normally. Do not reuse a disposable mask and always change it as soon as it gets damp. Medical masks, also known as surgical masks, are flat or pleated. They are affixed to the head with straps or have ear loops. Drinking alcohol does not protect you against COVID-19 and can be dangerous. The harmful use of alcohol increases your risk of health problems. Spraying and introducing bleach or another disinfectant into your body will not protect you against COVID-19 and can be dangerous. Do not, under any circumstance, spray or introduce bleach or any other disinfectant into your body. These substances can be poisonous if ingested and cause irritation and damage to your skin and eyes. Bleach and disinfectant should be used carefully to disinfect surfaces only. Remember to keep chlorine bleach and other disinfectants out of reach of children. Drinking methanol, ethanol, or bleach does not prevent or cure COVID-19 and can be extremely dangerous. Methanol, ethanol, and bleach are poisonous. Drinking them can lead to disability and death. Methanol, ethanol, and bleach are sometimes used in cleaning products to kill the viruses on surfaces. However, you should never drink them. They will not kill the virus in your body and they will harm your internal organs. To protect yourself against COVID-19, disinfect objects and surfaces, especially the ones you touch regularly. You can use diluted bleach or alcohol for that. Make sure you clean your hands frequently and thoroughly and avoid touching your eyes, mouth, and nose. Exposing yourself to the sun or temperatures higher than 25 degrees Celsius does not protect you from COVID-19. You can catch COVID-19 no matter how sunny or hot the weather is. Countries with hot weather have reported cases of COVID-19. To protect yourself, make sure you clean your hands frequently and thoroughly and avoid touching your eyes, mouth, and nose and following guidelines. The COVID-19 virus can spread both in hot and humid climates. The best way to protect yourself is by maintaining physical distance and following guidelines. By doing this, you eliminate virus that may be on your hands and infections that could occur by touching your eyes, mouth, and nose. Cold weather and snow cannot kill the COVID-19 virus. There is no reason to believe that cold weather can kill the new coronavirus or other diseases. The normal human body temperature remains 36.5 Celsius to 37 degrees Celsius, regardless of the external temperature or weather. The COVID-19 virus cannot be spread through mosquito bites. To date, there has been no information nor evidence to suggest that new coronavirus could be transmitted by mosquitoes. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes or through droplets of saliva or discharge from nose. Hand dryers are not effective in killing the COVID-19 virus. Hand dryers are not effective to protect yourself. Frequently clean your hands with an alcohol-based hand rub or wash them with soap and water. Once your hands are clean, you should dry them thoroughly using paper towels or a warm air dryer. People of all ages can be infected by the COVID-19 virus. Older and younger people can be infected by COVID-19 virus. Older people and people with pre-existing medical conditions such as asthma, diabetes, and heart disease are more vulnerable to becoming severely ill with the virus. So World Health Organization advises people of all ages to take steps to protect themselves from the virus. For example, by following good hand hygiene and good respiratory hygiene. Antibiotics cannot prevent or treat COVID-19. Antibiotics work only against bacteria, not viruses. COVID-19 is caused by a virus, and therefore antibiotics should not be used for prevention or treatment. Some people who become ill with COVID-19 can also develop a bacterial infection such as a complication. In such case, antibiotics may be recommended by a healthcare provider. So with this, we shall conclude commemoration. Apart from this, we have National Fruit Cake Day, a day for lovers of fruit cake to rejoice the delights of most misunderstood fruit. And today is also Make Cutout Snowflakes Day. If you are good at art, then be ready with art supplies for Make Cutout Snowflakes Day. Today is also Visit the Zoo Day. So when was the last time you visited zoo and connected with wild animals? It is in the context of US. An early form of zoo or zoological garden was called a menagerie. Or menagerie. It is said to have much smaller than the more than modern zoo. The first iterations of zoos were private collections and acted as a show of power. Excavators discovered remnants of a menagerie in Egypt, which they believe dates back to 3500 BC. Famous kings such as Alexander the Great, Greece, King Solomon of Israel, and King Nebuchadnezzar of Babylonia were known animal collectors from their respective times. In the West, evidence of such zoos or collection of animals has been found in places like China and Rome, and even in India. The first modern zoo was built in 1793 in Paris, France. This idea of the modern and public zoo appears to have become popular in the 18th century during the Age of Enlightenment, when science became more of a central pillar to the society. individuals wish to study animals to understand their anatomy and behavior, among other things. The city of London also saw its first modern zoo being opened in 1828. Animals from the Tower of London were added to its collection in due course, with the zoo eventually opening to the public in 1847. The focus of modern zoos was not on functioning as natural habitats for the species housed in them. Instead, they were more like museums of living animals kept in small display areas. Zoos today work towards educating and entertaining members of the public while also furthering scientific research and promoting the conservation of species. We have National Zoo Lovers Day, celebrated on April 8th every year in the US. And visiting the local zoo is the best way to celebrate this day. Of course, zoos are not ideal for animals because there is a history of mistreatment of animals by zoos. The introduction into the wild and ethical research are often not the primary concern of some zoos. And zoos are also perfectly safe to visit with establishments having to adhere various sets of rules to ensure visitors' safety. So locate your local zoo, visit the zoo and raise awareness. Encourage your family and friends to visit zoo and help support the animals near you. So the largest zoo in the world is India's Sri Venkateswara Zoological Park is the world's largest zoo. In Tirupati, Andhra Pradesh. Africa's big five, lions, rhinoceros, leopards, elephants, and the African buffalo are considered to be the Africa's big five and can be found together at a zoo at the Gondwana Game Reserve in South Africa. London Zoo and Winnie the Pooh. Millie named Winnie after his son's teddy bear, which was itself named a Canadian black bear that Millie's son often saw at London Zoo. So it highlights the importance of animal conservation. This day reminds us of how vulnerable animals are to the harmful effects of human development. It is important to be mindful and inclusive of animal life at all times. With time, humans have seen the divide between themselves and the wildlife growing. This is an important day to reconnect with the nature. We all read about animals and their habitats in class, but seeing and observing them in real life is perhaps the right way to cap off all these lessons. So we have similar commemorations on July 1st, American Zoo Day, and March 16, National Panda Day, and the National Zoo and Aquarium Month in June every year. So, and various other days dedicated to animals, animal welfare, animal conservation, and prevention of animal cruelty and suffering. So with this, we shall conclude today's commemoration. Thank you everyone for joining with us, and quickly fill up the feedback form raised in the form of polls in Zoom platform. So see you all tomorrow at the same time.